So we will move forward to our next presentation, which is going to be on psychosocial support, and I will actually be presenting that information for you today. Just as some brief background about my experience and involvement, I had mentioned before I am the Programs Director for Debbie's Dream Foundation. I've been on our staff for over 4 years and a volunteer for several years before that. My primary role with the organization is to engage with patients, provide these the development and oversight of all of our educational programs as well as our support programs. So I have a lot of direct communication and contact with patients. But I am also a licensed marriage and family therapist, and my specialty area is working with patients and healthcare teams who are working with chronic illnesses such as cancer. And so I'm very pleased to be able to talk to you briefly today about some of the support systems and common experiences that patients and their families do experience. And so some of the goals for our talk today, to discuss the common experiences of patients and caregivers, to review and provide some short tips and suggestions for supportive care that you might be able to easily implement as part of your daily routines. And then I'd also like to discuss the DDF resources that are available to help provide similar support systems as well. And so a cancer diagnosis places an obvious stress and strain on the patient as well as their families. And this can happen at so many different levels. Emotionally and cognitively, patients are experiencing changes in how they might think and feel about themselves, their diagnosis, as well as their relationships. Behaviorally and physically, there are very quick changes that are taking place because particularly with gastric cancer, we think about the difficulties that patients are facing in terms of digestion, eating. If they've had a surgical intervention for a partial or total gastrectomy, they're immediately going to need changes in their dietary requirements, the frequency of meals, and there's a lot of adaptation that needs to take place, which is going to be shifting both the physical and behavioral experiences of daily life of things that used to be very commonplace. Socially, you might experience limitations as well. I think for so many of us, time is one of our most valuable commodities that we have available to us. And with the inclusion of a cancer diagnosis, the strain that places, as well as needing to attend doctor's appointments, traveling, those limitations are immediately going to impact the social life and social setting in ways in which you engage with your family members, your loved ones, and your friends. Financially, I know that question just came up in regards to some of those treatments. Covering the costs of financing cancer care is insurmountable for many people. There are insurance agencies and copays that you will have to cover, and sometimes those are extensive, in addition to the consideration of the idea that not all treatments are covered, and you may need to be spending a lot of time communicating with your insurance provider, getting authorizations for your treatments, as well as your tests, which can prolong the time between the test being ordered, being completed, and then also getting the results from that, as well as the same for treatments. And then spiritually or emotionally in that regard, many patients and their family members will question some of their spiritual beliefs or religious beliefs. We often hear from patients that they are asking that question, why did this happen to me? I know from our founder's experience, she had no risk factors. She did not smoke, did not drink, didn't have any family history of cancer, and yet still she was faced with this difficult diagnosis and challenge of her lifetime. And so that can be very problematic. Conversely, though, many people also experience an affirmation of their belief system, or they may start to explore ideas that they've not incorporated as part of their life before. And so the diagnosis certainly does influence every aspect of your life. And so I want to kind of look a little bit more in depth about how this happens for individuals. And each of the presenters this morning, and all of you know, they had mentioned that, and all of you know, that the cancer diagnosis, treatments, everyone is an individual. You're going to respond differently. You're going to have different experiences. And part of that is about your biology, but also about your relational and social systems and how you perceive and understand your diagnosis and your treatment. So the biological factors look at the onset of your diagnosis. How quickly did this come on? For many patients that I speak with, they took months, sometimes longer, to reach their diagnosis after their first experiences of symptoms. And this is an incredibly frustrating experience to know that there's something wrong and that whatever tests or treatments that you're undergoing to understand it, to cure it, to fix it, have go unresolved for long periods of time. And all that while the cancer may be progressing, becoming metastatic, and making it more and more difficult for treatments and positive outcomes. The course or prognosis in terms of when you're diagnosed, at what stage, what is the prognosis and outlook for your treatment, for your survival. This is a huge influence on how people understand this, how they relate to it and process their diagnosis, and how they're able to adapt to many of their treatments. As Dr. Kovler had mentioned, some of the different lines of therapy, understanding how your illness is going to be progressing is going to be influencing the treatments that are available to you. As well as how they impact your quality of life, looking at those multiple lines of therapies or combinations of therapies. What type of life is it that you'd like to have, and how do you incorporate quality of life conversations into your communication with your doctor? Managing the treatments and side effects of how those chemotherapies or immunotherapies are impacting you physically, mentally as well. We hear a lot about chemo brain from patients having difficulty with memory and completing tasks throughout the day that once used to seem very simple. And there's always a level of uncertainty. Your doctors are always doing their best to give you the best information to have successful treatments and successful outcomes, but there's always this element of the unknown in terms of your response. How long is that response going to last? And that really does influence how a patient and your family are adapting to and surviving in a way with this treatment. Socially and emotionally, it's important to look at your lifestyle before cancer as well as during your treatment options and after. If you think about a family who's experiencing already a great deal of stress or duress for any number of reasons, adding a cancer diagnosis onto that is going to make it incredibly challenging to navigate the healthcare system, to overcome some of the other challenges that are going to be proposed to you. And as a patient or a caregiver, it would be important to sit down and talk about priorities as well as goals and outcomes that you find would be beneficial and reasonable to you, and learn how to communicate that to your doctor. Which brings me into some of the systemic things, the different organizations that patients and caregivers are asked to interact with, like the healthcare system or insurance providers and organizations and that sort of thing. You have to start to learn the different ways in which the healthcare systems operate, who to communicate with and when, how frequently, when to ask for help. And coming into this, you're also, for a person who had been previously healthy before their diagnosis, are learning to use language and terms that you may not have ever heard before. You are being spoken to using this terminology, and many times patients liken this experience to moving to a foreign country without having learned the language, without knowing how to get around or who to talk to about this, and you're trying to find your way through a foreign country and adapt and take care of yourself and survive. And when we're looking at something like stomach cancer, where oftentimes we're having life and death conversations, or that experience of urgency is in place, it becomes that much more difficult to navigate. So many people have their own individual experiences when they're diagnosed and during their treatment. It would be, I think, impossible to attempt to capture all of those different emotions. So if you're experiencing something and it's not listed here, it's not out of an abnormality. It's really just about trying to understand what some of the most common experiences are and emotional processes that are happening during the course of treatment. So at the very beginning, during diagnosis, patients as well as their family members tend to feel very overwhelmed. They might be shocked. They could be fearful, depending on their diagnosis and staging, their confidence level in their healthcare team in terms of what the outcomes will be. You may also experience depression or anxiety or anger that needs to be addressed and identified, and so that it doesn't start to spiral into other problems in your life. As the time subsides or you start to undergo your treatments and getting the shock might be wearing off, and then you might start to face some of the side effects. And these are the behavioral adaptations that I was talking about, how you live day to day and manage the different challenges that you're faced with, like your side effect management, fatigue, chemo brain, nausea, or pain are going to impact you in a great way. And any of the emotional responses to those physical experiences are completely understandable and normal. And for those who have gone through their lines of treatment and hopefully have a successful outcome, it would make sense that for the most part, you would feel relief, you might feel grateful and happy, you have been given back this chance at living. However, it's very common to also at the same time continue to be fearful because of a possibility of recurrence. And I do hear quite a bit from patients that they're experiencing a survivor's guilt, that they know so many people in their community of stomach cancer patients and loved ones who have faced this and they have lost their battle or they have passed away from stomach cancer. And then we get back to that why me question. Why am I still here? Why did I get to live when others didn't? And that's a very difficult experience to understand as well and to incorporate in your daily life. And then finally, if the disease does reach its terminal stages, there's, again, that questioning of spiritual belief systems, engaging in new practices and new understandings. And the grieving process can begin, sometimes it may begin all the way from the very beginning at diagnosis, but once we start to have conversations about, terminal, there are no more options for treatments at this point, we've done everything that we can, then when those conversations start taking place with your doctors, you might start a new grieving process, as well as your loved ones as well. And so I tried to capture some of the statements. I've pulled some of these off the internet from some of our support groups and networks that we're involved with, of experiences of what they have said. And the first being, since caring for my husband, all I do is sleep, live, and think about cancer. I really need to take a break, but I feel selfish. And so clearly this is from someone who is a caregiver who it has now taken over their life at this point. The next says, we're getting scans to see if treatment's working. It's the fourth line of chemotherapy, and there's only one other option after this treatment. And so it's going to be a long and anxious 2 days. And I think so many patients can relate to this anxiety when you're heading in to get your PET scans or your CTs and MRIs to see how effective your treatment has been and what the next steps are going to be. The waiting game from being scheduled for your test, from taking your test to getting your results, and then understanding what that means in terms of next steps is a huge hurdle that patients need to overcome. And my sister is stable now, but will not improve. And it seems that the support has dwindled. And do people just get tired of a difficult but currently unchanged situation? And I see this often as well, where patients who are newly diagnosed or families who are newly sharing the information of the cancer diagnosis with their loved ones are rallied around by their friends and family. And then over time, as things either don't change or become better, the support, the calls, the checking in slowly starts to taper off. And then patients and caregivers can start to feel very lonely and on their own in their cancer treatment. And so I'd like to just make some recommendations in terms of supportive care. And the first, because it's my background and part of the talk today, I want to talk a little bit about therapeutic services and how you might be able to engage working with a licensed mental health professional, whether they're a family therapist, a mental health counselor, social worker, psychologist, psychiatrist. There are numerous licensed professionals, but I'd like to encourage each of you, if you are considering doing this, that you can talk to your healthcare team if you're at one of the larger cancer centers or a comprehensive cancer center. It's very likely that they will have these services available to you, that you can request them and have someone who's staff at that facility working with you and with your treatment team. But that's not always a reality when you're being seen in the community or by smaller practices, and you may need to look outside of your treatment center to gain this assistance and support. And so if that is the case for you, I'd like to encourage everyone to look through the reviews, the information about the therapists that you're interacting with, and check to see if they are a specialist in oncology or in medical issues, because there are a lot of hurdles and navigating systems that come into play when we're talking about diagnosis of cancer and how it impacts you. And so a specialist may be a good benefit, but it's not always the case. So a therapist who you are working with could assist you in recognizing those biological, relational, and social dimensions that I was talking about earlier. They can help you to identify those experiences and factors that are impacting your day-to-day life, to be able to make some recommendations to improve your daily quality of life, maybe to help build some new skills and strategies and behaviors to adapt to the different challenges that you're being faced with. They can also help you make sense of your diagnosis and your treatment process and how that is impacting you as well. Therapists are trained to be empathic and supportive listeners, and for those of you who have contacted Debbie Stream Foundation have often said, I really just want to be able to talk to someone who understands. Many times that is referencing coming to a person who has had that diagnosis in the past. But again, in smaller communities, that's not always directly available to you. However, we can match you with someone by phone, but the face-to-face interaction can also be beneficial. So if that's something that you're looking for and you haven't been able to find that face-to-face support, consider enlisting someone who's a licensed professional to assist you with this as well. They offer that environment and help you to share and process the emotional factors that are also impacting you. And all of those can weigh in on your behaviors in terms of medication management and adherence, getting to your doctor's appointments, and you can start to see how when you're having a hard time getting out of bed that you may not be as compliant with your medication, you may not want to get to every appointment, or you may be getting there late, and then you have to start to ask, how are those different factors piling up and impacting my overall care? And they can assist you with that as well. And another great thing, many of the families who come to see me in my practice who aren't facing medical illness say, we need to talk about our communication. And this is doubly true for patients and caregivers with stomach cancer or any type of cancer, because you aren't sure how much to share, how much you might feel like you're burdening either your loved one or the patient themselves. You don't know where that line is. And so oftentimes people withhold a lot of information and they're carrying this themselves and feeling like they're alone in it. And no one wants to go through this journey on their own. And so Therapeutic Services might also assist you in opening up that communication between your loved ones and family members. But they can also assist by participating in those medical teams. If there are staff at the facility where you're being treated, as the doctors had mentioned, you may have that they would come in and join part of those team meetings and discussions. But if they're outside of the practice, you can also ask that they consult with your treatment team, or that your oncologist or surgeon may consult with them in the other direction to provide some points for conversation facilitation, things that are important in your care that your doctors would like to see improved, or vice versa, things that you would like improved in your care that your therapist might be able to assist in communicating that to the treatment team as well. And then also to increase a sense of agency among patients and caregivers. And what this is referring to, the agency is related to how well a patient or a caregiver is able to understand the healthcare system and advocate for themselves, asking questions to your doctor, complying with medications, communicating when medications aren't working, that side effects are causing barriers to you continuing in your treatment the way that your doctor has asked you to. And so your increased sense of agency, when you have this, you're able to share more with your doctor and you become a much more active participant in your own healthcare. Other ideas for supportive care options are face-to-face support groups. Similarly, they are very supportive and empathic. Oftentimes, they are led by a licensed professional. However, sometimes they're fully peer-led, but they offer this peer-to-peer networking where you can talk to other patients who have similar experiences to you. And with the really increased wealth of technologies available to us, these are no longer only face-to-face meetings that you might have to go to and travel to, but that you can find on social media and on discussion boards and forums where you can interact and engage with patients virtually throughout the day in a continuous type manner, and that way the physical distance is not any longer a barrier to having this support. There's also some really great options for video conferencing that also allows you then to see the person that you're speaking with or the people that you're speaking with, but again, overcomes the barrier of physical distance. Relaxation techniques are very useful in reducing stress, anxiety, helping to just navigate and take a break from the day when things start to pile up and get too much. This could include meditation, breathing exercises, going for a walk, just kind of stepping outside of yourself and taking a moment to just reset and recalibrate so that you can go back to whatever task it was that you needed to get done. Complementary strategies like acupuncture, massage, or integrative medicine are also excellent for supportive care. They support overall health and wellness. I do recommend that if this is something you're interested in or considering, again, if you're at a comprehensive center, this may be available to you, but as you explore these options, be sure to talk to your oncologist and those who are prescribing your medications to ensure that there won't be any interaction or difficulty with the medications that you're being prescribed, because we don't want something to lose its efficacy over certain treatment options. And again, adapting your health behaviors, taking a moment to review what your priorities are. What treatments are you being prescribed? How often do you need to take them? How often are you attending doctor's appointments, going for blood draws, and the like? And set goals with yourself, but also with your loved ones. Make sure that someone in your family who's attending appointments with you is aware of what are your goals for therapy. At what point is the side effect that you're experiencing too much to bear? And what are the ways in which you'd like to talk to your doctor about that so that you can look at and explore some new options and have some very honest conversations with your treatment team. And self-care really cannot be ruled out, and this is for patients and caregivers as well. Using creative outlets like art, music, dance are incredibly restorative. They do not take much time or materials. It can be done just about anywhere. You may want to try to explore some new hobbies or get engaged in a hobby that you maybe gave up a while ago. Something that you can do that replenishes you, and it also sets this tone for having cancer-free time. And you may want to do this just by itself, is to have a cancer-free zone at home where there's times or places in which you have other things in your life that are the priority, and maybe you don't talk about cancer at that moment, and it allows everyone in the family an opportunity to experience some sense of normalcy or the way that things used to be. And here I just have some overall tips for healthy lifestyle, so everybody can incorporate these, but also really important. Eating a well-balanced meal, and a tip for this because there are days where there's too many appointments, not enough time, or just too much stress or exhaustion that you maybe don't feel like preparing that well-balanced meal. So instead of running out and maybe grabbing something that is convenient, consider on days where you have more flexibility to cook something ahead, freeze it so that you have it available to you, something that's quick and easy. Getting a good night's sleep is also incredibly important. This is your body's opportunity to rest and recuperate and reset for the next day. So even though that list of things to do keeps growing and getting longer and longer, make sure that you're taking time to take care of your body. And that also includes maintaining your physical activity as well as your regular healthcare appointments. And then in terms of organization or stress and anxiety, using a calendar or a journal to help you organize the different appointments that you have, the medications or timing that you need to take, places that you need to be is useful. I also like to recommend that using a journal, whether it be a daily journal or something that you create and make for yourself, where you can log how you have felt each day, if you've experienced certain reactions. And this is a really useful tool for you to take that journal with you to your doctor's office, and when they ask you that age-old question, how are things going, you have some answers right there, because it's difficult on the spot to recall when you had a side effect. How did you feel 2-3 weeks ago? So you may not be able to report back everything. So using a journal may assist in you having those conversations with your doctor as well. It's also really important to ask for help. And this is great for caregivers to make sure that your friends and family can be there for you. We hear from that group so often that they say, I want to do something, but I don't know what to do, so I stay back because I feel like by asking how can I help or just being there, I might be underfoot or in the way. So if you need some help, don't be afraid to ask for it. It's important to be honest with yourself about your limitations and capabilities so that you can really make the most out of the daily life. And so just briefly, I know I touched on these in the introduction, around the ideas of supportive care and psychosocial support that Debbie's Dream Foundation is able to offer. We do have our patient resource education program. This includes the information on our website, Stomach Cancer 101, the lecture library. We also send information out to patients and their family members when they register for this on our website. You get a packet of leaflets, and we are actually currently working on a stomach cancer journal and guidebook that will have a high-level overview of the different treatment options and terms and things like that that you might experience, but will also include the daily journal that I was talking about, where you can log how you've been feeling and any side effects or things you'd like to share back with your doctor. We also have an online support community of our own that you can find on our website. It is hosted through Inspire. It's set up like a discussion board, so you can go in, create a free account, and log in. You can share your own story. You can sit there and read what other people have asked and other conversations that have been taking place. But it's a great opportunity for you to go in and hear from cancer patients who are around the world who are facing the same challenges that you are, and have great tips and advice and suggestions for what they are doing. And one thing I'm really excited to announce, I just got an email about this, is that the Inspire is going to be launching an app for your phone, so it will be more accessible. You won't necessarily need to log in through that portal, but you'll have an app on your phone that makes it much more interactive for you. And then you can also request a mentor. This is the part of the patient resource education program that matches patients and caregivers with survivors and their caregivers as well, to have one person that can help them navigate and understand what's been going on. They may also make suggestions for conversations to have with your doctor, and we'll also let you know what they had been through, how they handled it. It's not medical advice, but it is coming from someone who has been in the position that you've been in. And so this is a great thing to be able to take advantage of. And again, just a quick snapshot of what our website looks like and where you can find all of those resources under that tab. And the education information is in that left-hand column, support services in the middle, and news and updates you'll find on the right-hand side. And I always like to end a talk like this with this specific quote. It really was meaningful to me when I first started this work to find this quote, that there is no path. You make the path as you walk. And it really speaks to this individualistic perspective that everyone is going to have their own responses, their own experiences, and it's so important not to judge your path versus someone else's. Knowing that one person had one outcome and you had something else doesn't make yours or theirs bad, better, worse. It's just different, and it's yours. And so, being able to be honest and talk to your doctors about what your goals are, what you'd like this path, this journey to look like, helps you create it to be individualistic. No one wants to walk this path, but when we do, we want to make sure that it is ours and it feels comfortable and we're confident in the directions that we're taking. So, thank you so much.